New research has found that healthcare workers dealing with the COVID-19 pandemic in Singapore are experiencing lower levels of anxiety and psychological distress when compared with previous outbreaks. That could be due to increased mental preparedness following SARS. For a closer look, we're joined by Associate Professor Vijay Kumar Sharma from the NUS Yong School of Medicine and by Sociology Professor Paulin Straughan from Singapore Management University. Thank you both for joining us. We'll come to you first, Professor Vijay. How much correlation is there actually between increased mental preparedness and stringent infection control measures versus anxiety and psychological distress levels among healthcare workers?
Actually, it started from the SARS period. When in 2003 we were attacked by SARS, there were about 238 individuals which got infection. And surprisingly, 97, which makes about 41% of them were healthcare workers. And the mortality at that time was 14%. So that was a lesson to us. And that prompted us that we should be prepared that something like this can hit us again. So as a car, I take it back like this, that probably we were anticipating that something like COVID-19 will be coming back again. So since 2003, we had implemented in the hospital very strict infection control measures. There were training programs for mask, hand washing, and they were very frequently done, almost like 6 monthly. Everybody has to undergo that kind of training. So that prepared us. So what happened, as soon as we got this COVID-19 attack, at least our all healthcare workers, they were immediately mentally prepared that we can jump into this war field and then we can battle it out, definitely. So this showed that we were mentally prepared. Now, one important thing in this fighting, such an outbreak like COVID-19 is that we should have knowledge and we should have confidence. So we were prepared with the knowledge because hospital had prepared education programs. There was a transparency. We were updated on a daily basis what was the condition of COVID-19, how COVID-19 gets infected, how people get infected, how to prevent yourself from getting infected. All these things, they were in place. So that prepared us from knowledge point of view. And confidence, we were trained strongly and for a very long period how to fight infections, how to be clean, how to prepare ourselves for these infections. Probably that prepared us to fight this battle. So we were both strong in our confidence as well as mentally preparedness from our experience.
So Professor Vijay, saying that, then how is the situation here in Singapore compared with other parts of the world that are also struggling and dealing with COVID-19?
So I can talk about the healthcare workers. So I told you about the Singapore story, but what happened outside, there are very, very few studies which are available on healthcare workers. What is the psychological impact of this illness? Whatever we have got a couple of studies. One came out from Italy, one came out from China, and it was seen that almost all healthcare workers, they were having some kind of psychological impact, and it was at least moderate in severity. It's to be taken in account that both these countries, Italy as well as China, they were massively hit. The magnitude of impact of COVID-19 infection was immense. The Italian studies showed that about 10% of those who got the infection, they were actually healthcare workers. So this was such a heavy toll. They will definitely be having much more psychological anxiety, stress, depression, and all kind of emotional reactions which were seen in media, from Italy and China. They were probably a reflection of the magnitude of the scale of this event. And we know it that Europe and West, they were never prepared for such kind of attacks. They never have suffered these kind of attacks. It's Asia, Africa, which have been going through all these attacks in between, the epidemics, they keep coming. So we were definitely mentally, as well as physically, as well as from resources point of view, we were definitely better prepared.
Professor Straughan, we're 1 week into the circuit breaker now, and already some tightened measures have been kicked in as a result of some who've been sort of testing boundaries, if you like. Based on what you've observed so far, are people behaving in a way that's sort of expected during a time like this?
First, let me thank all our healthcare workers. I think that they really deserve our admiration and praise and for keeping things in control. So with regards to the general public, right, I think we are the opposite, right? Vijay said that the healthcare workers, the professionals were prepared for the next infectious disease, attack, and therefore when COVID came, they were all ready. The lay public, on the other hand, we've been so safe in Singapore. We have been so used to having, a very peaceful life. So this came as a big shock to us, right? And when the measures stepped in that we had to vary our normal everyday life, it took Singaporeans a longer time to get used to it because they just don't understand at one level, that this disease is so infectious. And at another level, it is also difficult to break from norm habits because we have lived in a very, very densely packed society. We're used to rubbing, elbows with each other. So therefore, if I'm not touching you, that's already social distance in my mind, right? So what more this 1 meter, 2 meter thing? So I think we had to learn, and I think the way Glenda had laid out, the rules as they are layered on was quite remarkable. It demonstrated to me, it made me realize that it was a step-by-step calibrated approach, and in every stance, government had trusted Singaporeans, to abide by the boundaries, and when we failed, then more stringent rules had to be stepped in, had to be rolled in because we had to protect the vulnerable. So I think that at the end of the day, most Singaporeans are okay. Obviously, when you go out to the streets now, it's very empty. People are law-abiding. No one is crowding you out in the supermarket or in the hawker centers. And we're trying our best to be good citizens and to do our part. We hear of, those who are, who break the rules because for whatever reason. But I think most cases is because they don't understand. But by and large, I think the community has pulled together. This is certainly one of the better places to be in at this time, in this global crisis. I think all of us who live in Singapore are very grateful that we are here. So all in, I think we're doing our best. We can do better, and I'm sure in the weeks to come, we will demonstrate that we will be able to do better.
Okay, well, thank you both for speaking to us this evening. Associate Professor Vijay Kumar Sharma from the NUS Yong School of Medicine and Sociology Professor Paulin Straughan from the Singapore Management University.